Hello, I'm Elizabeth Zhang, and I am a board-certified ophthalmologist and plastic specialist practicing in Cleveland, Ohio. So some people will actually have droopy eyelids, and that can be for multiple reasons. But if it's enough that it's blocking your vision, insurance will actually cover surgery in order to lift the eyelid. Now, for some people, it just may be that they have extra eyelid skin that's kind of weighing down their eyelid and making it so it's causing a hood. Uh, and some people actually will get this surgery done for cosmetic reasons, but if it's actually to the point where your side vision to the side or your superior vision is covered, then that's the point where insurance will actually cover the surgery. So in order to figure out if you're bad enough that insurance might cover it, what you want to do is you can actually use your forehead muscles to lift up your eyebrows, and that then you also lift up your eyelids. And if you can see more to the side or up above, then there's a good chance that your eyelids are actually blocking your vision, and you may want to see an oculoplastic specialist like myself to see if you can have surgery, and insurance would cover taking off that extra eyelid skin. So if the eyelids are low just because of extra eyelid skin, then the surgery is called blepharoplasty, where the skin is taken out and muscle and fat may also be taken out, and then the skin sutured together in order to take off that extra weight so that the eyelid can lift. For some people, they may have something called eyelid ptosis, and ptosis refers to droopiness. And so that's often because the muscle that's lifting the eyelid is no longer lifting as high. And so in that case, even if you take off that extra eyelid skin, the eyelid is still going to be low. There are multiple different kind of surgeries that can correct ptosis. And so having an evaluation with the oculoplastic surgeon is the best way to figure out what surgery is right for you. So benefit of these surgeries is obviously to give you back your peripheral vision. And for most people, they are happy with the change in appearance. It usually gives you a slightly younger appearance. However, risks include scarring. So if you're making incision, anytime you make an incision, there can be some scarring. Now, the incision here is usually on the eyelid crease line, so it typically heals really well. For lots of my patients, you can't really see that they ever had surgery once they are healed, but there are some people who end up having maybe a little bit of bumpiness along that incision that usually does smooth out with time. After surgery, there's always going to be bruising, and you may have like a kind of black eye look. You're going to have swelling. The swelling usually gets worse for about 2 to 3 days and then starts to get better. It's really important to use cold or ice on the eyelids afterwards. That's going to keep that swelling down. My instructions that I give to my patients are 15 minutes every hour, more often if you can, even like 15 minutes on, 15 minutes off. Frozen peas, frozen corn, the Ziploc work well so that molds around your eyes if you don't have like access to crushed ice, which of course works great as well. My patients are really good about doing a lot of icing. Typically, their swelling will be gone around 2 to 3 weeks. And I did have one patient who just didn't ice at all, and she still had a lot of swelling after a month after surgery. So that ice makes a huge difference. Any surgery has a risk of bleeding and infection. Usually the risk of bleeding here is low, but if you are on anticoagulants like aspirin, Plavix, Eliquis, Coumadin, warfarin, those are things that you want to talk about with your surgeon. Risk of infection is fairly low. We use kind of a clean surgical technique to prevent infection, but it is always possible and often just treated with oral antibiotics. Obviously, there can be a change in your appearance. Usually, like I said, the change is favorable, but some people may not be as happy with the change. There can be some asymmetry. One eyelid may end up a little higher, a little lower than the other, or the contour of the eyelid may not be quite the same. So these are all things that you want to talk about with your surgeon if you're considering having this surgery. This video is made for educational purposes and it's not meant to be medical advice. I hope you did get some information out of it. And if you are in the Cleveland area, I'd be happy to see you as a patient. Thank you.